Omicron, the new COVID-19 variant, is out and has been detected in 38 countries so far, including USA. It's depressing, but it's about to become a new normal now. Curious to know how Omicron started and what its origin is? Let's not make you wait any longer. On November 24, 2021, a new variant of SARS was reported to the World Health Organization. This new variant was first detected in specimens collected on November 11th in Botswana and on November 14 in South Africa. On November 26, 2021, WHO named this new variant of COVID as Omicron and classified it as a variant of concern, VOC. On November 30th, the United States designated Omicron as a variant of concern, and on December 1st, the first confirmed US case of Omicron was identified. The Omicron has now been confirmed in at least 16 US states and 38 countries from all over the world, and it is likely to rise. Dr. Rochelle Wilensky, director of the Centers for Disease Control and Prevention, said on Sunday on This Week, although the Delta variant of COVID makes up 99.9% of US cases, Wilensky said, Omicron is spreading quickly. A leading European health agency predicts Omicron could become the dominant COVID strain in the upcoming months. Big question is, how easily does Omicron spread? The Omicron variant likely will spread more easily than the original SARS-CoV-2 virus, and how easily Omicron spreads compared to Delta remains unknown. CDC experts that anyone with Omicron infection can spread the virus to others even if they are vaccinated or don't have symptoms. Are you curious to know, will Omicron cause more severe illness or not? We don't have a clear answer to that, as more data is needed to know if Omicron infections, and especially reinfections and breakthrough infections in people who are fully vaccinated, cause more severe illness or death than infection with other variants. In the US, President Joe Biden is doubling down on urging vaccines and booster shots until more information becomes available. Experts caution it could be 2 or 3 weeks before we know exactly how contagious Omicron is and if it can cause more severe illness than other mutations on the virus. So far, the COVID-19 vaccines have proved to be highly effective in preventing hospitalization and death, with people who are unvaccinated being more than 10 times more likely to be hospitalized if infected. Vaccines makers are optimistic the current vaccines authorized for use in the US will provide a degree of protection against Omicron too. Van Kerkhoff, an American infectious disease epidemiologist, said it's still too early to understand the severity of disease caused by Omicron. Early reports of mild symptoms in some of the first cases where it was identified were based on a cluster of university students who tend to be younger and experience more mild symptoms than other adults, he said. There was initial reports that it tended to be more mild, but it's really too soon. Van Kerkhoff said everybody who's infected with SARS-CoV-2, regardless of what variant, will always start out with a mild disease, and so maybe it will stop there with mild. Some people are asymptomatic, of course, but it may stop with mild disease or it may take some time. We are not done yet. We have some tools for you to fight this new COVID variant. Vaccine remains the best public health measure to protect people from COVID-19, slow transmissions, and reduce the likelihood of new variants emerging. COVID-19 vaccines are highly effective at preventing severe illness, hospitalizations, and death. Masks offer protection against all variants. CDC continues to recommend wearing a mask in public indoor settings in area of substantial or high community transmission, regardless of vaccination status. CDC provides advice about masks for people who want to learn more about what type of mask is right for them depending on their circumstances. Tests can tell you if you're currently infected with COVID-19. 2 types of tests are used to test for current infection: nucleic acid amplification test and antigen test. NAT and antigen tests can only tell you if you have a current infection. Individuals can use the COVID-19 viral testing tool to help determine what kind of test to seek. Additional tests would be needed to determine if your infection was caused by Omicron. Visit your state, tribal, local or territorial health department website. Look for the latest local information and testing. So, that's all for this video, but don't worry. We will keep you posted about what's going on in this ever-changing world and how things are evolving. But for that, you need to subscribe to the channel and also do ring the notification bell so you don't miss any of the important updates like this one. We will see you in the next video. Until then, goodbye.